Welcome to the Deep Dive. Today we're tackling a really significant area, one that often flies under the radar a bit.
We're looking at the idea of reparations for harm.
Specifically, harm experienced by vulnerable people living in an institutional setting.
Exactly. And we've gathered some important research articles and reports.
Right, sources focusing on experiences of people with intellectual disabilities, those living with dementia in aged care.
And also the broader disability rights issues, the role institutions play.
So our mission for this deep dive is really to get to the heart of it all.
Understand the arguments for reparations, what they might actually look like.
And the complexities, the challenges in addressing harm that happened maybe years ago, but still impacts people today.
Yeah, think of it as a shortcut, getting you up to speed on a crucial, often overlooked conversation.
Okay, so let's unpack this. Where do we begin?
Well, let's start with the historical context, maybe. Our sources really bring to light those large institutions, the ones that used to house people with intellectual disabilities.
Ah, right. The ones involved in deinstitutionalization, sort of, later in the 20th century.
That's the ones. The movement was about closing those big segregated places and, supporting community living instead.
But what's striking, you mentioned, is how little people actually know about them now.
It's quite shocking, really, the lack of public awareness about these places and what life was like inside.
It's almost like a forgotten chapter.
It is. And what's fascinating is when researchers actually spoke with people with intellectual disabilities,
Yes.
there was really strong support for engaging with this history. They see it as vital.
Vital for what, exactly?
For acknowledging the past wrongs, for sure, but also for tackling the ongoing issues. Things like institutionalization that still happens, segregation, exclusion.
So it's not just about the past. It connects directly to achieving equality now.
Precisely. It's not just that these institutions existed, it's that the systems, the attitudes that allowed them, they still subtly influence things today.
Leading to ongoing issues. That's a key point.
It is. And remembering this history, learning about it, it needs a really sensitive touch.
How so?
Well, we need to understand the complex reasons people ended up there, especially children, and be really aware of the trauma.
The ongoing trauma for individuals, families, whole communities even.
Exactly. It runs deep.
And I have to say, for many listeners, maybe even myself included, connecting these historical institutions directly to today's disability rights movement, that might be quite new.
It often is.
Really makes you think about the journey and how far we still need to go. Okay, so shifting focus a bit. The sources also talk about harm within aged care facilities.
Yes, specifically for people living with dementia. And unfortunately, there have been numerous inquiries over the last, 2 decades, all uncovering significant problems, significant harm in residential aged care for this group.
But the surprising thing you mentioned to us.
The lack of concrete recommendations in those very inquiries, recommendations for actually recognizing the harm, redressing it, repairing it.
That is surprising. Do the sources give any clue why that might be? Why the gap?
They don't spell it out explicitly, no. But I mean, it does make you wonder about the focus, doesn't it?
Like maybe more focused on fixing the system for the future rather than dealing with past harms to individuals?
Potentially.
Yeah.
Or maybe focused on the institutions themselves, and what's even more, alarming.
Go on.
After the big Royal Commission into Aged Care Quality and Safety here in Australia, instead of boosting accountability.
You'd expect that, wouldn't you?
You would.
Yeah.
But the government actually brought in legislation giving aged care providers immunity.
Immunity from what?
From civil and criminal liability in certain situations involving restrictive practices.
Wow. Okay, that lack of accountability really sets the stage for these arguments about reparations, doesn't it?
It certainly does. The sources strongly argue for applying international human rights standards, the ones about reparations, to what's happening in aged care.
So broadening the definition of gross human rights violations to include harms faced by people with disabilities like dementia.
Exactly. The whole point of the project detailed in our material was to build that evidence base.
An evidence base showing why reparations are needed.
Yes. And their scope, what harm needs covering, what forms could reparations take, what processes would work.
All focused on people living with dementia in residential aged care.
Fundamentally, it's about their human rights, their right to justice, to have harm addressed, just like anyone else.
And the sources stress the urgency, right?
Very much so. They argue, look, we already have plenty of evidence of harm past and present. We don't need more investigation into if it happened.
The harm is established.
Right. Plus, reparations are already a thing in international law, and they've been used in Australia before. Think about the stolen generations.
So there's a precedent, an existing framework.
Exactly. And the crucial, perhaps saddest point is that many who suffered harm are older.
There's a real risk they might pass away before seeing any kind of justice.
That's the urgency. And you really hear it in the voices of advocates quoted in the material.
What kind of things are they saying?
Well, there's this profound frustration, almost despair, about the lack of accountability in aged care. A feeling that inquiry after inquiry happens, but nothing really changes on the ground.
I remember one quote stood out. A volunteer advocate saying something like,
You can't get redress when you have no authoritative system.
that was it.
Yeah.
So the idea of redress is going to be rendered actually nonsensical.
In the system in which there is no accountability. Stark, isn't it?
Very. And another advocate, a lawyer, echoed that, feeling the abuse just continues without real accountability.
It really brings home that point. Without responsibility, making amends feels
Well,
empty.
like trying to fix something without knowing what broke it or who broke it.
Yeah, exactly. Okay, so if we accept the need, what might reparations actually look like? The sources talk about these dementia reparations principles.
Right, developed specifically for dementia in aged care, but you mentioned they could apply more broadly.
Potentially, yes. To other institutional settings for people with dementia, disability, older people, maybe even non-institutional care, like home care.
And what are the core ideas behind these principles?
They're grounded firmly in human rights. That's the foundation.
Yep.
Then centering the individual, their diverse identities, their lived experiences, making sure processes are trauma-informed, culturally safe.
That sounds crucial. And accessibility.
Absolutely vital.
Yeah.
Disability inclusion, accessibility, especially for people living with dementia, that needs careful thought.
Makes sense. What else?
Making information accessible, providing independent advocacy.
That seems really important in settings where people might struggle to speak up for themselves.
Hugely important. Then, transparency, clear timelines for outcomes, communication, enforcement.
So making sure it actually happens.
Yes. And finally, legality. Everything
Right.
needs to align with domestic and international law. They summarize it with the panel approach.
Panel, what's that stand for?
Participation, accountability, non-discrimination, and equality, and legality.
Participation, accountability, non-discrimination, and equality, legality.
Okay. It's a framework to ensure the process is legally sound, but also involves people, holds providers accountable, and upholds equality.
Got it. So those are the principles. What about the specific forms of reparation? What do the sources suggest?
Several key things come up. First off, truth-telling.
Why is that seen as important?
It's about acknowledging the harm, first and foremost, educating the public, too, and validating experiences, especially for family and carers.
Though maybe less directly relevant for someone with very advanced dementia themselves.
Possibly, yes, the sources acknowledge that. But the key is safe, facilitated processes. You have to avoid re-traumatizing people.
Of course. What else? Apologies.
Yes, both public, formal ones, and maybe more personal apologies. Symbolic recognition.
But there's a danger there, isn't there? The hollow apology.
Absolutely. Words without action, without meaningful change, can feel worse than useless.
Which leads directly to systemic reform.
Exactly. Highlighted as absolutely vital. Preventing future harm.
House policy changes, legislation.
Training too, human rights training, dementia-specific training for staff, and much stronger accountability.
The idea of a fit and proper person test for staff came up too, I recall.
It did, yes, as a potential safeguard. Then there's the question of money.
Monetary payments. What role could they play?
Symbolic recognition, again, validating the harm, but also practical support, paying for better care, for advocacy.
But the sources also flagged concerns.
Yes, worries that money might become the focus, overshadowing the need for systemic change, and the practical issue.
That the money might just get swallowed up by aged care fees anyway.
Right, a real concern for people still in care.
Okay, what other forms? Rehabilitation, support.
Crucial. Access to medical help, psychological support, legal aid, social services.
But not just within the facility.
No, emphasis on rebuilding connections, belonging outside the institution, and counseling for families and carers too. They often experience trauma.
That's often overlooked.
Yeah.
And lastly,
Commemoration. The idea of creating sites to remember people who died in these circumstances.
so it's a really comprehensive picture of what repair could look like.
It aims to be. But as we know, getting there isn't simple. The the sources also dig into the barriers.
The obstacles to justice and redress. What's the biggest one?
Well, one really profound concept discussed is the double injury.
Double injury.
Yes. First, the harm itself happens. Then second, society and the legal systems fail to even recognize the person living with dementia as a victim.
That lack of recognition. It's dehumanizing.
It absolutely can be.
Yeah.
Then there are the existing complaint system.
The regulators, what's wrong with them?
Often their focus is more on compliance, is the facility ticking the boxes, rather than providing individual redress for harm done.
Right. And people might be scared to complain anyway.
Definitely. Fear of retaliation is a very real thing in these environments.
And even if someone does get a settlement, say, out of court.
It's often confidential, doesn't set a legal precedent, doesn't help others down the line.
And what about specialized schemes, like the one for child sexual abuse survivors?
The National Redress Scheme. It gets criticized, too. Narrow definitions of harm, processes that are slow, difficult, not transparent.
And, crucially, not really driving systemic change.
That's a major criticism. And importantly, there isn't a scheme like that for people living with dementia harmed in aged care.
Which just highlights the need for, what, independent advocacy.
Absolutely critical. The sources really stress this. In an institution, your ability to advocate for yourself can be seriously diminished.
This is the control of the environment.
The loss of agency that can happen with institutionalization, segregation.
And this links into international human rights law, doesn't it? The CRPD.
Yes, the UN Convention on the Rights of Persons with Disabilities. Basically, it says people with disabilities have the same rights as everyone else.
Including the right to live independently, be free from harm, treated with dignity.
Equal recognition before the law, freedom from violence, liberty, personal integrity, community inclusion, all of that.
And the CRPD committee, the body overseeing it, actually talks about reparations in its guidelines on deinstitutionalization.
It does, yes. It sees a role for them.
But there's a wrinkle with Australia's position.
Well, Australia made some specific interpretive declarations about certain parts of the CRPD.
Meaning?
Meaning there are concerns these declarations might actually hold back needed reforms, might allow human rights breaches to continue.
Okay. The sources also brought up intersectionality. That's important too.
Hugely important. Harm isn't experienced in a vacuum. It can be made much worse by overlapping discrimination.
Based on things like disability, obviously, but also ageism, being indigenous, gender, sexuality.
Exactly. So reparations need to be tailored. They need to account for these specific intersecting vulnerabilities.
Are there examples in the sources?
Yes, things like the specific fear members of the stolen generations might have of being caged in when entering aged care.
Understandable, given their history.
Or the impact of past discrimination on older LGBTIQA plus individuals, and the need to see harm to First Nations people, not just individually, but in terms of the impact on family, kinship, community.
It adds layers of complexity, but also necessity to getting reparations right.
Absolutely. And that links to learning from other schemes.
You mentioned the National Redress Scheme for child abuse survivors earlier, learning from its successes, but also its failures.
Perhaps especially its failures. While it helped some, it's faced heavy criticism.
For things like?
Being inaccessible, processes re-traumatizing survivors, not being properly trauma-informed.
So any scheme for people with dementia must avoid those pitfalls.
It has to. By genuinely centering their perspectives, promoting self-determination as much as possible, ensuring cultural safety.
And addressing that practical issue of redress payments affecting aged care fees.
That needs sorting out urgently if people are still in care.
Now, finally, it's worth remembering, this isn't just about aged care, is it?
No, definitely not. The broader context is the institutionalization of people with disabilities across various settings.
Mental health facilities, prisons.
Exactly. And the sources argue strongly that institutionalization should never be seen as protection or as a real choice.
They talk about disability-specific legal regimes of detention, regulation, and intervention. It sounds quite ominous.
It refers to legal frameworks that single out people with disabilities for specific forms of control. There's a need to acknowledge and remedy past instances of these.
And we see the results in things like the overrepresentation of people with disabilities, especially Indigenous Australians, in prisons and other institutions.
It's a stark reminder of broader systemic problems.
All connected, really, to the wider issue of violence against people with disability.
Yes, including acts that might not legally be torture, but are still cruel, inhuman, or degrading treatment.
And again, Current complaint systems often aren't effective at preventing or addressing that violence.
Clearly, more effective systems are needed.
So, wrapping up this deep dive, it's clear reparations are incredibly complex, multifaceted.
Especially for people harmed in institutions like those living with dementia or people with intellectual disabilities.
Yeah, I think the key takeaway for me is that moving forward isn't just about fixing individual harms when they pop up.
No, it demands fundamental system change, real accountability.
And an unwavering commitment to upholding human rights for everyone, especially the most vulnerable in our society.
So maybe a final thought for our listeners.
Go ahead.
Consider what a truly reparative approach to care and support might actually look like in our society.
And what role each of us might play, even in small ways, in bringing that vision closer to reality.
Exactly. Something to reflect on the ethical, the societal implications of all this.